So dilated aorta and aneurysm are pretty much the same thing. They're along the continuum of this thing called aneurysm. I guess that's the most familiar term. Dilated aorta is kind of on the earlier scale of what it means to have an aneurysm. If you think about an aneurysm, you think about something large and is about to rupture potentially. So we typically don't call aneurysms in the chest by that name, aneurysm, unless they're a little over 4.5 centimeters or so. So we have a lot of patients who have smaller sized aortas that are still not normal. Normal size of the human aorta, which is the blood vessel that immediately exits the heart. Kind of where it first comes out should be less than 3.5 centimeters typically, and we're talking about diameters, and then it narrows down to about 3 centimeters, and it gets progressively smaller as it gives off branches to the body, to the brain, the arms, and then it heads down into the back. And by the time it gets to the legs, it's much smaller, maybe on the order of 8 millimeters, eight tenths of a centimeter. So dilated aortas are maybe an ascending aorta that is 4 centimeters or 4.2 centimeters. What we kind of tell the patients is that if your aorta is it's basically a protein and connective tissue tube. It's like just a tube. And that tube is made up of 1,000 different ingredients on a molecular level. Just like any recipe that you might prepare in a kitchen at home or in a restaurant, if it's a complex recipe and it has many, many ingredients, if you're missing one ingredient or you have to substitute one for another, the dish might come out pretty much the same, but to you you might notice that it's a little different. So missing one key ingredient or having a modification of one of your proteins is going to make your aorta more likely to stretch out over time. And remember, the aorta is absorbing all of the force of the first beat of the heart, the blood that's rushing out of the ventricle. The aorta is pulsating, just like the pulse in your wrist is a branch of the aorta. The aorta itself is basically pulsating beat to beat. People who are at risk for dilated aorta or aneurysm over time, their aorta just progressively starts to grow in size, and that's what it means to have a dilated aorta or an aneurysm. The how did I get it relates to the genetic risk for why I got this in the first place. Aneurysms in the chest above the heart are a little different than aneurysms in the belly. Aneurysms in the belly, abdominal aortic aneurysms, those are usually a consequence of smoking, hypertension, blood pressure, certain lifestyle factors, probably also some genetic risk in there as well. But aneurysms above the heart are very different. Whereas aneurysms in the belly have a lot of calcium, cholesterol, and debris in them, aneurysms above the heart are usually pristine on the inside. These aortas were pre-engineered from the time of conception to dilate at some point during that person's lifetime. Some people may manifest a dilated aorta or aneurysm at a very young age, even in childhood or adolescence, but others may take an entire lifetime to develop even a modestly dilated aorta or aneurysm.